Care work is the backbone of societies and economies. Globally, women and girls perform a disproportionate amount of unpaid household care work. Without affordable and quality options, care for the elderly, individuals with disabilities, and children falls primarily to women and girls who provide this work unpaid. This often results in negative impacts for their economic participation, independence, time, and well-being. And yet, policies and financing for care have not been prioritized globally, and care work remains undervalued. Across low and middle income countries, paid care work is largely informal, with low wages and poor working conditions. The COVID-19 pandemic dramatically compounded gender disparities in paid and unpaid care work even further, impacting women's labor force participation and obstructing women's economic empowerment, justice, and rights.
Due to gender discrimination and social norms, women around the world typically spend more time on unpaid care work than men. With this gender gap in unpaid care work, women and girls are less likely to attend schools, develop skills, and participate in the labor market.
We want to ask ourselves, are the childcare facilities, are they affordable to women? Are they accessible to women? And are they of good quality? And that our women who are carrying out their businesses, they can afford this.
Dianggap pekerjaan ini tidak memerlukan keahlian khusus ataupun pendidikan tertentu.
Poor medical care and access to health facilities, health information, and also since they are earning low wages, they don't have insurance.
又冇勞工保障啦，冇病假啦，好多社會嘅福利都冇，又冇產假啦。醫療啊，都嗰個病假都冇。
The time for action is now. WeProsper's evidence-based recommendations make a clear case for policy change. It is a critical time to invest in holistic and transformative policies for care, including quality and affordable services and infrastructure, which support rights and decent work for care workers.
Care constitutes one of the most important factors that can enable women's work participation rates.
Bahwa PRT adalah manusia, PRT adalah perempuan, dan PRT adalah ibu-ibu dari anak-anak mereka di kampung. Mereka sanggup meninggalkan keluarga tercinta termasuk anak.
Investments in the care economy are critical to supporting human rights, well-being, and women's economic empowerment. Through these investments and shifts in policy, together we can strategically advance economies worldwide and address structural issues preventing progress for women and girls.
There is a very important need to redistribute the burden of care work between the state and the households. The state should take responsibilities of providing proper care infrastructure.
This calls for a change now in the mindset, legislation, and practices to share care work equally and to build a more gender equal economy.
WeProsper calls on policymakers, governments, and donors to prioritize investments in quality and affordable care services and infrastructure, whilst also supporting inclusive COVID-19 recoveries, sustainable economies, and women's economic empowerment, justice, and rights.